A neck lift, I literally mean your neck. One of the biggest things to know that will really dictate what is the best option for you. I would not recommend liposuction. Let's talk about the aging neck. What do I mean? I literally mean your neck and how it changes over time as you age, and what are the different things you can do to address the neck if it's something that bothers you. I've personally always said that a neck lift is one of the procedures I would not hesitate on doing as I get older if my neck started to drop, because I truly think that the neck is one of the areas on the body that really shows your age more than anywhere else. Why is that? Because what happens is as time goes on and the neck starts to sag, or if you gain and lose weight and then have more fat deposition throughout the neck as we get older, it really begins to blunt the angle of the jaw, which then creates this image basically from head to the collarbone where there isn't a clear distinction of where the face and the neck get separated, and therefore makes you kind of look more uniform in appearance in a sense that doesn't really accentuate the features that make you look the most youthful, one of those being the jawline and the general facial bone structure. So what is it that you can do about the neck? Well, ultimately it's going to depend on what problem you actually have when it comes to your neck. One of the biggest things to know that will really dictate what is the best option for you is what is your skin quality like? I mean, how thick is the skin? Is it super thin? Do you have pigmentation of the skin? You know, what's your baseline level of pigment? And also, another thing important to note about the skin is what's the extent of sun damage that you have to the neck, because a lot of times some of those more superficial and fine lines and wrinkles that can form are going to be harder to attack, especially if you have significant sun damage. Now, that doesn't mean it's impossible, but it just makes my job a little bit harder, which is also kind of the fun part for me. Let's talk about liposuction of the neck. When is that appropriate? Well, a lot of people come to my office saying like, oh, I have just this like loose hanging skin with fat underneath it. Can you just do some liposuction to have it just all suck back down and give me that nice sharp jawline I had when I was younger? Well, it doesn't always work that way because again, it comes down to the skin quality. If you are usually on the older side and have thinner skin or have enough stretch of the neck skin that it may not recoil back, then I would not recommend liposuction for you. And that's a decision I would make in office with you after doing an examination, really looking at what your skin quality is like and where that fat is actually located. Another time that I would not recommend liposuction at all is if the fat is actually underneath a muscle on the neck called the platysma muscle. The platysma muscle is these two sheep muscles that sit right here along the neck and basically go from the jawline down to the clavicle. And that's actually, I'm going to make a funny face for you here, but when you go like this, that's where you can see those bands that start to form. And as we get older, those bands can get more and more accentuated. So what do I do when the fat is beneath the muscle? Well, that needs to be removed directly under visualization because there's a lot of important structures in your neck, as you can imagine, such as major blood vessels, your trachea, your esophagus, that exist pretty close to the surface. If I tried to go in there with a liposuction cannula, it could cause a lot of damage and truly be life-threatening. So that's why it's much better to be done under direct visualization with an actual neck lift. Now, what does a neck lift mean? A neck lift is referring to a procedure where I surgically actually open up the neck. Now, there's something called a limited incision neck lift where I will only do an incision right here under the chin, and that's really only reserved for certain patients who have good skin quality but have that fat underneath the muscle, not over the muscle, so they're not a candidate for liposuction, but just a little bit of removal of that fat and a good skin quality will allow that skin to kind of stick back up into a position that is more youthful and then gets rid of that fullness underneath the neck. But if you are somebody who has things such as that platysmal banding I was talking about, a lot of loose sagging skin, plus or minus the fat, then you are more so a candidate for a more extensive neck lift or a deep plane neck lift. How does that differ? Well, the incision that I was talking about under here is still going to be there, but it will then be compiled with an incision that usually begins at the bottom of the earlobe, right where the earlobe attaches to the face, and then carries up behind the ear in the crease, and then up and oftentimes a little bit into the hairline. Why? Because that allows me to access the neck from both sides because I lift off all the skin of the neck, go in there, really contour the muscles, get them nice and tight, oftentimes sew those muscles back together in the midline, which is called a corset platysmoplasty. And yes, you heard it right. It's just like a corset where you're essentially cinching that together to really bring things up and tighten them. So ultimately, it's really going to depend on what issue you're specifically having with your neck, but I have always said that a neck lift is one of those procedures that would be a no-brainer for me as I get older if I did have problems with a sagging neck, because I truly think that an aging neck is one of those areas that will really show your age faster than anywhere else. And it's not just about vanity, but it's also the fact that when you look in the mirror, when you have a sagging neck, you lose definition of the jawline. It makes you look more tired, not just older. And ultimately, when you look more tired and you look at yourself in the mirror, psychologically, you will almost always feel more tired. So there is an actual rejuvenating concept to doing a neck rejuvenation, not just for the neck itself, but for your psyche. When it comes to non-invasive procedures for the neck, there aren't a lot that I typically would recommend. There are things out there such as Morpheus and M-Sculpt. The reason I don't really like those procedures is because I think that the results are pretty minimal, the cost is pretty high, and in the case of some of those radiofrequency treatments where they're actually injecting heat into the skin to theoretically build collagen or also some form of scar to tighten things up, you're going to then make it so the result is minimal, but you probably will need surgery. And as a result, because now you've done this procedure, you have more scar, you're going to end up having a little bit more difficulty of recovery and a slightly higher risk of complications. So my general position is, if you are worried about your neck, if you feel like your neck is sagging and it's bothering you and making you look older or feel more tired, I definitely recommend that you contact my office so that we can chat about it, because it's really going to depend on your specific skin type, where your fat is located, what problem you're specifically having, and also where your neck was at baseline and what your goals are. So again, if you're interested, go ahead and contact my office and I'd love to discuss it with you.